Very pleased to have as our next guest an internationally recognized physical therapist, sensory integration specialist, and author, Sally Fryer Dietz. She founded Integrative Concussion Therapy in response to a growing need for comprehensive concussion care. Sally Dietz, welcome to the Mike Schickman Show. It's great to have you.
Thank you so much for having me.
Well, this is a big issue. And unfortunately, we really don't treat it among young people the way we should, let alone the way older folks who may bang their head or play some, we'll just call it some fun games and hit their heads one way or the other. I used to get my concussions through falling up and hitting the lid of my car. And I would just go, and black out for a second or two. And, like macho men were always supposed to, it's nothing. Take a little sniff of whatever and you're fine. Well, that's not the truth anymore.
Yeah. Well, I think we know so much more now, and there, with that awareness, comes responsibility for protecting our kids. And we know that the younger you are when you receive a concussion, the greater potential for long-term sequelae as a result.
First of all, let's define our terms. What is a concussion?
So a concussion happens when there's any kind of a jolt to the brain. It's actually a metabolic cascade that happens within the brain where it's as if you had an egg and you shook up a raw egg, the egg yolk gets all displaced, or you had a snow globe and you shake that up and all the little particles kind of float around. It can happen with a direct blow to the head, and it can also happen with an indirect blow to the head. You don't even have to hit your head to actually suffer from a concussion.
And it really is the brain hitting against the inside of the skull, right?
That's correct. And you could get what's called torsion effects, where the brain actually kind of gets twisted in the skull, and that leads to even more serious, kind of long-term injury.
Wow. Because I'm thinking of all the crazy rides I've been on.
Yeah.
And they scare me from the outside now, but who knows what kind of damage it is. Even if, you're driving in traffic and have to hit the brakes hard and you're wearing your seatbelt, you're still going to get that head snapping one way or the other.
That's right.
So explain how your system works.
Well, it's not so much of a system as that everybody is very different, and you need a therapist or a physician or whoever it is to really do a complete evaluation so that they are looking at the person's vestibular system, what happens in the inner ear, and your balance. You're also looking at the visual system, what happens with the eyes and how that matches up to your vestibular system. And you're looking at the cervicogenic, or the problems of the neck, because a lot of times neck injury will cause symptoms that look very much like a concussion. So the first step is having a really good eval where there is somebody looking at all of those things together, including, what are your symptoms, the big picture, what was the mechanism of the injury, how are you feeling now? How do you feel at the beginning of the day versus the end of the day? And really puts together a good idea of what's going on. And then you tailor the treatment plan to the needs of that individual. So there's no cookie-cutter approach in this kind of thing. You really have to look at everybody differently and bring as much expertise to the table as you can. It's not about just giving them a pill or sending them home to sit in a dark room. You really want to see what's going on and treat the systems that are involved.
I've been saying for many years that with all the talk about high school football and college football and the pros and CTE and all this, that I always thought that soccer caused more concussions than anything else, than any other youth sport, because A, you're not wearing any protective equipment, B, you're hitting a ball with your head, and not all parts of the head are meant to hit anything with.
Yeah.
And girls seem to be suffering from concussions more than boys.
Well, girls are actually, while all kids under the age of 18 are vulnerable, girls are actually more prone to concussion and more prone to lengthier recovery times. So, a lot of that has to do with their anatomy and the amount of fluid that's around the brain. That fluid doesn't just protect you, it allows for more movement within the skull. So, girls can really be set up for having bigger problems, and yet they tend to go very much so under the radar because people don't pick it up. The coaches, they might ask the girl, how are you feeling? And she says, I feel okay, I can keep playing. And she, gets out there and keeps playing. And if she's lucky, she doesn't sustain another injury.
And there is something more, and that is that young women are very team-oriented.
Right.
And they feel like they're letting down the team. You're talking to somebody who's been involved with women's basketball for 40-plus years, as well as men's basketball. And there's much more of a team than a me. The other thing is there are so many other types of illnesses, injuries, not to mention your menstrual cycle, that may affect the way you quote-unquote feel, that people would discount. Oh, she has a headache. She's probably yada, yada, yada.
Right. Or she's just temperamental, or, she's moody, or, there's so many soft signs of a concussion that go unrecognized. And, we'll have parents who won't really pick up on their kids' symptoms until their grades start to drop, or they just notice that they just aren't the same as they used to be. I get that all the time from parents who just say there's just something not quite right. I can't put my finger on it.
Dr. Sally Fryer Dietz is our guest. We're talking about concussion therapy, and she joins us today from concussion therapy and her integrative concussion therapy that she has found, and it's fascinating to me because to some people, I knew a young lady, I'll leave her nameless, that had multiple concussions, and she lost the spark in her eye.
Right.
And I don't know if she ever got it back because, after she graduated or left school, you don't really keep track of them.
Right.
How do you know you're over these things?
Well, that's again where it really helps to have a good professional on your side who's really looking at the big picture and listening to you, who really knows how to observe, who knows the signs and symptoms. We have very concrete measurement where we can look at, balance and visual function and vestibular function that can tell us, where a person is, and even exercise tolerance, where you can work with people and push them to a point where you see if any symptoms are evoked or not. So having, not being in a big hurry to get back to really waiting until you're completely healed and having that really concrete objective assessment done that says absolutely you are recovered from this and not just going on a hunch that you should be over it by now.
Dr. Dietz, it's even more than just your brain itself. We mentioned earlier you can get kind of a whiplash effect that may force some sort of concussion, but also other muscular and physical problems.
Right.
So it's more than just, she has a headache, he has a headache.
Yeah, you bring up a great point. What's interesting as well, certainly from a physical therapy standpoint, is with a concussion, the increase of a lower extremity injury goes up dramatically after the fact because your spinal reflexes are off, and many times if somebody does go back to play too early, we'll see an associated ACL tear or a problem with the knee or the ankle or even the hip as a result because they don't have the right balance reactions yet.
I was talking to a guest about dealing with some other illnesses, including Alzheimer's. And they follow an osteopathic pathway, which I guess what you guys do at ICT is very similar in some ways.
Well, we use a lot of different combination of treatments. Like I said, we have the vestibular rehab therapists. We have therapists who are really trained specifically in all these different things. But we also have craniosacral therapists. That's a wonderful technique for calming down symptoms so that we're able to actually do the therapy that's required, but follow it up with this very light manual therapy that helps people to actually feel better. So you get the benefit of the rehab, but then you leave feeling better, which increases your compliance rate dramatically.
Dr. Sally Fryer Dietz, I wish we had more time. Where can people find out more?
So we're in Dallas, Texas. We have a website, concussion therapy.com. The name of the practice is Integrative Concussion Therapy, and we've got lots of information on our website, and they can look for us there.
It is a pleasure chatting with you. Please come back and join us again, won't you?
Thank you so much.
That's Dr. Sally Fryer Dietz. We're talking about her founder of Integrative Concussion Therapy.